Hi, everyone. I'm Andrea. I'm a senior research fellow and strategic theme lead for children and young people's social care at the Research Support Service delivered by Lancaster and Partners. And I'm here going to talk to you today about some of the NIHR specific fellowships that are offered that might help you with your research career. Nicky.
Hi everyone, I'm Nicky Braithwaite and I'm the Centre Manager for the Specialist Centre for Social Care delivered by the University of York and Partners.
Great. So next slide, please. So what I'm going to talk today with you is the personal awards that are available for you to kind of undertake a research practitioner career. There's a few that you can go for, and I'm going to go through what they are. I'll talk a little bit about the application process, what that is, and give you some tips as well on doing your applications as well. And I also sit on the doctoral local authority panel as well, so I can give you a little bit of insight as to how we think about and assess applications as well. So there are three kind of key career development awards that you might be really interested in undertaking. The one that might be the most relevant for you now, which we'll talk about in more detail, is a pre-doctoral award. This award is what we'd like to call a kind of precursor to the doctoral. It gives you some support at a master's level so you can then feel confident in developing a PhD application. There's one opportunity per year that tends to open around January to March. You can take it for 12 months. Full-time equivalency, about 20% of your time can be used for practice. Now, with this particular pre-doctoral award, we'll go into more details around it, but it provides opportunities for things like completing a master's degree if you don't have one, or if you do already have a master's degree, it could be undertaking a specific one to help support your research development and practice. So learning about theory, learning about different kinds of methodologies to develop your research skills. It also gives you opportunities to develop your public involvement experience, so working with different people in communities, as Katie mentioned earlier, developing your kind of advisory group, as well as doing some networking, and it gives you some other kinds of opportunities, other kinds of training as well. Then when you've kind of completed that, we have the doctoral award, and this is a more formal PhD process. So you're kind of building from the pre-doc to the doctoral. So in the pre-doc, you're kind of developing your research skills, kind of thinking about what you want your research to be. Your doctoral is actually then going to do the research. So we run these twice a year. They open in April and close in June, and then they open again in October and in January. These are for 3 years. With a 50 to 100% full-time equivalency, and 20% of your time can be dedicated to practice. Unlike the pre-doctoral award, which is really about developing yourself to kind of get ready for a doctoral, the doctoral is a lot more competitive. And at this point, you are competing with other people who are also looking to develop their research careers. So the doctoral is a little bit different in that you need to have a really strong research application, a strong supervisory team, mentorship, and those are the kinds of things that we look for. And then we have the postdoctoral award. So on the completion of your PhD, many academics, myself included, we might go for something called a postdoc. And a postdoc is kind of, you get to continue your research. So if the doctoral award is kind of the training to be a research practitioner, the postdoc is kind of the next step. So kind of starting towards your goal to be a kind of research practitioner leader. The postdoctoral award can be anywhere from 2 to 5 years. Again, it opens twice a year in April and June. In October, December, you can take it for full-time, 50 to 100%, and you actually are allowed to dedicate 40% of your time to practice. Next slide, please. Now, there are different committees that review these awards. So many of you will likely, when you put in your application, it will get reviewed by the local authority social care and public health committee, which is the one I sit on. And many of us have expertise and specialty in this place. So we understand the context that you are applying for. We understand the kinds of projects that you are wanting to put together, and the spaces and places that you work in as well. Next slide, please. So all across the 3 awards, there are kind of some key elements that you'll need to develop. The first is your career narrative. This is really about who you are. There are about 5 modules that you will fill out to describe things like your impact and your contributions. Sometimes we often refer this as research contributions and impact, but in the pre-doctoral, for example, this would also include your practice impact and contribution. So it can be things like, what did you do to change policy in your workplace? How did you kind of make shifts and changes to better inform your practice and service delivery? It can be all those kinds of things as well. We also look for things like mentoring and mentorship experience. So who have you supported? Who have you mentored? Have you mentored students? Have you supported colleagues? That sort of thing. We look for your experience in research as well. So what previous research experience have you done? Have you worked on any research projects? Have you been part of any research projects, not necessarily as a researcher, but also as a frontline practitioner, as part of an advisory or consultancy group? We also look at what kind of impact you've had or kind of your experience in working, kind of getting research out or getting kind of practice and service delivery out into community as well. So what have you done to kind of work with different community organizations, collaborations as well? And then we also want to know why this award and why now. What do you think this award's going to do for your career? How's it going to support your career? Why do you want to go for this award? Why is this fellowship the next step for you? In the pre-doctoral, you'll do a research interest statement, and we'll talk about the pre-doctoral in more detail in a minute. But in the doctoral and in the postdoc, you'll do what's called a research plan. So this is really a kind of outline of the research that you're going to undertake and how you're going to undertake it. And the research plan is quite important in these latter two awards. We look for things like kind of how you're thinking about your theoretical frameworks, how you're thinking about your methodology and your chosen methods, how you're going to think about things like research inclusion to ensure diversity and equity and accessibility in your research, how you're going to kind of think about working with people and communities within your research plan, and things like project management, considering things like ethics, feasibility, all of those things. And when if you take the pre-doctoral award, you'll get a lot of training and support and guidance around all of those different elements that I've just mentioned for your research plan for the doctoral or postdoc. So I highly recommend that you consider the pre-doctoral. Then we also look for things like you'll develop a career development or training plan. So these are all the bits and pieces that the panel wants to see in terms of how you're going to develop your career. So that will be formal training like a master's qualification or other kind of formal courses that you might take to develop your research. We'll also want to see informal training. So it can be things like shadowing different researchers, doing different placements or internships at different organizations, or potentially at a higher education institute for research. We'll look for things like, conferences you might want to attend, either as just an attendee or even presenting some work, and all of those kinds of bits and pieces as well. Something that's really important to NIHR is working with people in communities. So what NIHR is really wanting is to ensure that any and all research that we do has had input from the people and communities that we're working with. So in your application, you'll be required to provide a statement around what have you done previously to work with communities prior to the development of your application, and how are you going to continue to work with those communities throughout the research cycle, and how are you going to continue to engage those communities kind of post-research as well. So that's really important. You'll also put together what we call a plain English language summary. So this is an accessible summary of what the work that you're going to do and why it's important. And you'll also, for the doctoral and postdoc, you'll do what's called a scientific abstract. So this is your more traditional kind of research abstract that you would see across different projects. And then as a part of that, you'll also need to do a budget and a cost justification. So you'll work with your local authority or charity organization to do the budget, and the cost justification is to kind of justify to NIHR why you need to spend this amount of money on these sorts of things. Next slide, please. So how it works. The first thing I would do before you even want to apply for an award, and we're going to focus on the pre-doctoral because I think for a lot of you, that's kind of the space you'll be in right now, is to make sure that you've got support from your local authority or NHS trust or where you're based, that you can apply for one. That's really important that you've got support from your line managers and the organization that you're based at. And then when you want to apply for the award, NIHR has an awards management system. It's all done online. You log in, you'll search through the funding opportunities. You can search for the pre-doctoral award, and when it's open, you can click apply now. Like a lot of applications, you don't have to fill it out and submit it right away. You can start the filling out process. You can save it and come back to it later. And then you'll develop your application. So the pre-doctoral award, the first thing is a research area of interest. So what we want to see is what's your research interest? What are you wanting to do? What are you wanting to work in? And why is that important? So it's a one-page statement that kind of highlights what the problem is, why you want to look at it, what's previous little bit of evidence around it is, and how you're going to do that. So that's, and ideally, one thing we look for as well is kind of an alignment between your research interest and some of the practice work that you've been doing as well. So we look very carefully for that. The second thing is a narrative CV. And so I talked about that before. It's a 3-page statement that is looking at, why now? Why is this award suitable for you? What kind of impact have you had in your practice work if you haven't done any previous research work? Again, like I said before, building, your experience in building relationships with communities, other research, and so on, and mentorship as well. And the career development plan, and this needs to be quite detailed. So when we're looking at your career development plan, we want to see how specific your training is. Have you looked at the courses that you're going to do, what the timeframes for the courses, justifying why you're going to undertake those courses, and other elements of your training as well. A Gantt chart. So Gantt chart is a kind of visual representation of your project management. So how you're going to use your time for the pre-doctoral award, and then letters of support from your supervisors, from the higher education institute that you're going to be located with, and from your local authority, and of course any other organizations that you might work with as well. Now, the pre-doctoral is only open once a year, so it's already closed for this year, but this is a great time to start thinking about it for next year, because it will open in January and it will close in mid-March. And then the funding decisions get made between June and August about whether you've been awarded the pre-doctoral or not, and then you can start as early as September 1st and as late as March 1st. And as Nicky's going to talk more about the Special Center for Social Care, and what we can do is provide advice and guidance on through the whole process of your application. Next slide. So there's been a few different current award holders that have been supported through the Special Center for Social Care, and they've had a couple of statements here that I'll read out for you. So NIC's, the NIHR Fellowship helped made research accessible to them. It's not just something for younger people with no commitments and plenty of time and money. They were able to kind of do this through being an experienced social worker and kind of identify some of the kind of personal life complexities as a trans non-binary parent with a mortgage and kids in a career. So what the fellowship provided for them is an ability to get paid while developing really important research skills, and a project that's actually really important to social workers and people affected by child adoption. And as we have for Lucy, for them, it was a first, toe in the water experience with practitioner research, which came through this pre-doctoral fellowship. It was an invaluable opportunity for them to bridge gaps in their knowledge, participate in conferences, and build academic networks. So that's why the pre-doc is a really important step for you. And it also gave them the chance to engage with the public, hear firsthand their thoughts on the research, and be inspired by insights and lived experiences, which is what Katie talked about before, that real importance of qualitative work, and being kind of informed by meaning and lived experience. And it really reinforced the importance of undertaking the research. Next slide, please. So what do you do if you're interested in exploring the awards? The first thing that we would recommend is that we have the Specialist Centers for Public Health and the Special Center for Social Care, and there are 4 hubs that sit under that. So we have 2 hubs for Special Center for Public Health, one based at Newcastle and one at Southampton, and then we have 2 hubs for Special Center and Social Care, York and Partners, and Lancaster and Partners. And there are a range of methodologists that can work with you on your application, and we provide a whole range of expertise that Nicky's going to talk about in a little bit. We also recommend that you check out the Academy Research Career Funding web pages to get an understanding of the fellowships, what's available to you and why, as well as you can look at what makes a successful award from the former chair of pre-doctoral award committee and the current chair of the doctoral award committee as well. So we provide some of that information for you as well. As I said before, you also want to find the right people to talk to in your organization. So you want to see who's leading research on social care, who in your managed structure might be interested in your research or have it within their remit. Are there colleagues that have already applied or investigated? So check with your relevant public health or social care teams. And as Katie noted before, you can link into peer support network of current and prospective local authority award holders as well. Next slide, please. The other thing is also finding opportunities. So does anyone know that you're interested in research opportunities? Some of you might be part of local authorities that have health determinant research collaborations. So places like Blackpool and Manchester, and many others have these. There's also other infrastructure opportunities through the applied research collaborations that support health and care research in local areas. You can check with your research, any of your partners. Is there anything happening in the universities in your local teaching partnership that might be relevant? As well as if you're based in the NHS, what can the local R&D teams tell you about social care research in NHS settings as well? So those are all ways that you can start to think about potential for research opportunities and developing your research practitioner career. Next slide, please.
Great.
Thank you.
Thanks, Andrea. Okay, so just moving on to the RSS then, Specialist Centre for Social Care. So Katie and Andrea have both touched upon this briefly. So the RSS, it's been set up for about 2.5 years now. I think about October 23 it got started. And the idea of setting up this service was to help individuals who want to submit applications to enhance and improve the quality of applications that may be submitted to the NIHR. So why are we here, and why am I encouraging people here to apply to the Specialist Centre for Social Care? First and foremost, it's free. It doesn't cost anything. Anyone is able to submit an application or come to us with an inquiry, and we're here to help. So no costs involved at all. Both Specialist Centres for Social Care in York and Lancaster, they're built with expert social care researchers, people who've been there, done that, they've got the experience and they've got a track record of being successful with their social care grant applications that they've submitted. We've also got advisors who know how the panels work. So a lot of people have got experience of sitting on panels, so they know the discussions that take place and they know how they make them decisions. So they're in the best place to help researchers submit their applications and know what to include and how to present them. And we've also got people involved who have got lived experience as well as grassroots organisations as well. So we can reach out to a broad range of people. So there's 2 options for support at the Specialist Centre for Social Care. It may be that you have a general inquiry about practice research. It may be that you're not quite ready to submit an application yet, but you want to look at your options, see what's out there and understand what path you need to take. If that sounds like a position you're in, then a general inquiry is what you'd be able to submit to the Specialist Centre. Or it also could be that you do have an application, you've got an idea that you want to submit, and we're able to help you, support you through that as well. And I'll go into some more details in future slides. So the help that we can offer for those with more of a general inquiry is navigating the research landscape, what's out there, what funding calls are available for you, looking at what's the best option available for you right now. We can help you make introductions, so we can involve public involvement. We can introduce you to other institutes or other organisations that may be able to help you with your research, and form an initial plan as well. So maybe putting a bit of a timeline together with you and working out what funding calls are available in the future and what steps do you need to take to be able to get there. All the general inquiries you submit are still provided by an advisor, somebody who will be signposted especially to yourself, and they'll be there to help you throughout your journey. If you get to the point where you've then got a specific application and it's something that you are going to submit to the NIHR, then we're able to help you throughout this journey as well. So you're able to submit a short inquiry form on our database, and that goes either to York or Lancaster, depending which centre you may pick. And then you will be allocated an advisor which is best suitable to you. So depending on the type of research application that you're putting in, you'll be assigned to an advisor who kind of meets your needs and who's got experience in your particular area. And like I said, that support will be ongoing. It's not a one-off support, and we provide support from the moment you touch base when the application is submitted, and we also provide post-application support as well, should that be something you wish to be involved with. So the advisor basically comes as a supportive, constructive, critical friend. They're there to help you frame your application. They're there to help you make sure that you've got future plans and make sure that you've got links with various networks that you might need in your social care research. They're there to ask them sometimes awkward and difficult questions as well, to make sure that they're stretching you and making sure that the application is meeting the requirements for the funder. Inclusion as well, also making sure that any current and future plans will be inclusive and representative diversity of experience, something that's really at the front of mind of NIHR at the moment. We also have dedicated help with fellowships, so some of the calls that Andrea has just been talking about. We can help make sure that it's the right scheme for you, helping you craft the narrative, which Andrea walked you through, and piecing the different types of the application jigsaw together as well: the person, the project, place, inclusivity and training. With fellowships, we also offer interview techniques and mock panels as well, should you be successful for an interview. The RSS Specialist Centre for Social Care, we ensure equitable support, so we are there for everybody. We promote inclusive research practices and all our advice and our guidance, and we support undeserved groups as listed on the slide there. So how can you get in touch with us? So you are able to go onto the NIHR Specialist Centre website. You'll see there is various boxes there, so you can either select York or Lancaster. I believe if you select the arrows on the web page, it will give you a background of the different areas of experience that both locations offer. It may be that there's no particular preference, so you're able to select the bottom left box there, and then that will come through to both Lancaster and York, and between us we'll triage applications where we believe they're best suited. On the web page also, that's where you can submit your general inquiries. So again, like I said, this is if you've not necessarily got an application you want to submit, but you're at the start of your journey and you want to ask some general questions to the Specialist Centre. You're able to do that on that web page also. Thank you. Has anyone got any questions?